Lacey Schooley, and today I'll be demonstrating bowel elimination techniques and care of an ostomy appliance. So I'm going to enter my med room, perform hand hygiene, and compare my physician's orders to my MAR. So I both of them for Dr. Leo, and I have Shirley Coast, 5/14/1964, 5/14/1964. So the first thing Dr. Leo ordered is a Docusate Sodium 10 mg rectal suppository. Docusate Sodium 10 mg rectal suppository, administer per rectal route for constipation, And then if there's no results from that Docusate suppository within 12 hours, we're going to administer a sodium phosphate 4.5 fluid ounce enema. So sodium phosphate 4.5 fluid ounce enema within 12 hours of the Docusate sodium suppository if there's no results. So all that matches, so we can just go ahead and work directly from our MAR. So I have my patient's bin here, and I'm just going to compare to make sure it's the right one. So I have Shirley Coast, 5/14/1964, Shirley Coast, 5/14/1964. Perfect. So I'm going to go ahead and start my first medication check. So I have the Docusate Sodium 10 mg rectal suppository. Okay, Docusate Sodium 10 mg rectal suppository. And then that sodium phosphate 4.5 fluid ounce enema. That's this, sodium phosphate 4.5 fluid ounce enema. And then for my second medication check, I have to put gloves on because I'm going to be preparing the medication. So for that suppository, I'm going to need a med cup and some lubricant, which I have right here. Okay, so I have the Docusate Sodium 10 mg rectal suppository, Docusate Sodium 10 mg rectal suppository. So for this, I'm going to put lubricant in the bottom of the med cup. That way, when I place in the suppository, put it in the tip first, it can get lubricated, and when I take it out, I can pick up some lubricant on my finger. And then I have the sodium phosphate 4.5 fluid ounce enema. Sodium phosphate 4.5 fluid ounce enema. So those are my two medications. So I'm going to go ahead and take off my gloves and get ready to enter the patient's room. So I'm going to knock, close the door, pull the curtain for privacy, go ahead and introduce myself, perform hand hygiene. Hi Shirley, my name's Lacey. I'm going to be your student nurse today. Can I just have you go ahead and verify your name and date of birth for me? Shirley Coast, 5/14/1964. Shirley Coast, 5/14/1964. And Shirley, do you have any allergies to codeine? Okay, that's what your allergy band says, and that's what I have here on my MAR. So Shirley, it looks like Dr. Leo has ordered a suppository for you since you haven't been able to have a bowel movement. Have you had a suppository before? You have? Okay. So I'm just going to go ahead and get you in the correct position. Okay, Shirley, I'm just going to put this pillow next to you. That way you can lean up against that instead of the side rail, make it a little more comfortable, okay? So I'm going to have you reach over with this hand and bend this knee, and then on the count of 3 we'll flip. Okay, ready? Okay, 1, 2, 3. Perfect. You in a comfortable position, Shirley? You are? Okay. I'm just going to go and place this mat under you. Just making sure to expose only what I need of the patient. I'm going to go ahead and do my third medication check. So I have the Docusate Sodium 10 mg rectal suppository. Docusate Sodium 10 mg rectal suppository. Okay, Shirley. So I know you've had a suppository before, but I'm just going to have you take deep breaths. And then on the count of 3, I'm going to go ahead and insert this suppository, okay? Okay, so when I pick it up, I'm going to make sure the tip of the suppository has enough lubricant, and also my finger. That way it's a little easier on the patient. Okay, Shirley, so on the count of 3, 1, 2, 3, I'm going to make sure that the suppository goes past the rectal sphincter and between the fecal matter and the rectal mucosa. Okay, Shirley, I'm just going to have you stay like that for 5 to 10 minutes while that enema works. Here's your call light. You can go ahead and call me if you need to use the bathroom before that. Dispose the tissue and the gloves. And then lay Shirley down. So it has been 12 hours now. Shirley has not had a bowel movement. We've documented the suppository, how it went for Shirley. So now we're going to go ahead, enter the room again, close the door, pull the curtain, do the hand hygiene. We'd introduce ourselves, verify the patient once again. Hi Shirley, so it looks like you haven't had a bowel movement yet. So it's been over that 12 hours, so Dr. Lee wants us to go ahead and do an enema. And have you had an enema before? You've also had an enema, okay. Well, we're gonna go ahead and flip you like we did yesterday, okay? Okay, perfect. So once again, just pull this hand over, grab that side rail, bend this knee, we'll flip on the count of 3, okay? Okay, 1, 2, 3. Okay, so we'd have our mat down, lay the mat down, and then just because there's a lot of fluid with the enema, we're gonna have our fractured basin. Okay, through our third medication checks, we have the sodium phosphate 4.5 fluid ounce enema, sodium phosphate 4.5 fluid ounce enema. So this enema does come pre-lubricated, but just to make sure that it is very comfortable for the patient, we're gonna put extra lubricant on it. Okay, Shirley, just like the suppository, I know you've had an enema before, but just need you to breathe nice and slow, and on the count of 3, we're gonna insert this enema, okay? Okay, 1, 2, 3. We're gonna insert it past the rectal mucosa, next to the rectal mucosa, making sure not to move it around so you don't perforate anything. And then we'd insert all of the solution, and then when that's done, pull it out. We'd have the patient stay like that for 10 to 15 minutes. In this case, Shirley has to use the bathroom right away. So we're gonna go ahead and flip Shirley onto this fracture pan. Okay, Shirley, just turn back over for me. Okay, and then we've used a bath blanket just to make sure that Shirley doesn't get anything on her sheets. That way we wouldn't have to change them and make it more uncomfortable for the patient. We'd elevate the head of the bed 80 to 90 degrees just to make the bowel movement more comfortable for the patient. If she wanted privacy, we could leave the room. In this case, Shirley's already went to the bathroom, so we would put new gloves on, perform hand hygiene, and then get ready to take the fracture pan out from below her. Okay, Shirley, same thing, bend this knee, go over, and then we're gonna flip on 3, okay? Okay, so then as I'm flipping Shirley this time, just gonna make sure I hold the fracture pan, that way it doesn't go with her and spill all over her bed. Okay, Shirley, on the count of 3, 1, 2, 3. And with a real patient, they would be a little more cooperative. We'll fold this up, take this away. We set it aside, and when we're done dealing with the patient, we take it into the bathroom, clean the basin, record the amount, the consistency, color, all of that for her NIO. We'd get new gloves on at this point and do hand hygiene with a warm washcloth. We will clean up the patient. And if the patient were to clean themselves, we'd make sure they don't throw the tissue into the fracture pan just so we can record. This would go in the biohazard container. Okay, Shirley, we're gonna roll you back down. 1, 2, 3. Okay. Done with that pillow. Cover her back up. Shirley, did you need anything else? So at this point, make sure the patient has her call light. But we are going to go to the other side and do the ostomy care now. We document, after we remove our gloves, we document on the INO record of her bowel movement. Okay, so we're gonna go to the other side, do the ostomy care. Okay, we're done with this stuff. Okay, so we'd enter the room, shut the door, close the curtain, provide privacy, perform hand hygiene. We would also verify the patient, the name and date of birth to make sure they match our MAR, any allergies. For the purpose of this, we're going to say that's all been done. Going to put on the gloves. Hi Shirley, how are you doing today? So Shirley has had an ostomy bag for many years, but sometimes she just requires a little assistance, so we're just going to go ahead and change it for her today. down. We put one chuck under her arm. These are just to protect your sheets and your bedding, just in case there's any leakage. Okay, Shirley? Okay, we'll tuck this one next to you. Pull the blanket down, just exposing the parts that we need. Pull this second check out. We'll just tuck it under your blanket, protecting that. Okay, we'll grab a fracture pan. I'll put the ostomy bag directly into the fracture pan. Okay, Shirley, I'm going to go ahead and take this off. Okay, we'll set this aside for later. We'll empty the ostomy bag, record the contents, the consistency, color, all of that. We get new gloves at this point to remove the faceplate. So we're going to use this adhesive remover and pull the faceplate towards the stoma and use the adhesive remover just to make it a little less, a little easier on the patient so there's not so much skin irritation. Just pull towards the stoma all the way around. Throw this in the biohazard container, discard that. And I'm just going to use an alcohol swab to clean around the skin, making sure not to touch the stoma. Okay. And then with a warm washcloth, clean the stoma from inside out. Okay, this will go in the biohazard container. And then while that's drying, I'm going to place a 4x4 gauze over the stoma. I would change gloves, perform hand hygiene at this point, and get the new faceplate and bag ready. Okay, Shirley, just gonna go ahead and measure that stoma, okay? So you wanna make sure, okay, we're gonna do 1 3/4 inch, okay? So it's a little bigger than the stoma, so we're not cutting any of the circulation off. Faceplate. We're going to use our stencil to trace around the back. Okay. And then using our scissors, we're going to cut out. While we're cutting, we're going to make sure that there's no jagged edges that would just make any more discomfort for the patient. That's unnecessary. Okay, so I do have a few jagged edges, so I'm just going to trim them up and make them smooth. Okay, so since at this point the area around the stoma is dry, so I'm going to go ahead and put stoma powder around it, just so that way any skin irritation doesn't build up and cause any unnecessary problems. I'm going to take off the back of this faceplate, put paste on the inner circumference, just a stoma paste, sorry, on the inner circumference of the faceplate, just to make sure that all the creases are just extra in place. Okay, I'm going to place that around the stoma, making sure not to cut off any of the circulation. Push down, but not too hard, that's uncomfortable for the patient. And then the stoma bag is already ready and clipped. That way, if stoma starts leaking just because we are messing with it, we don't have a mess. So I'm just gonna push until I hear it click. Okay, Shirley, that is all changed. Discard these in the trash. Cover the patient back up. Shirley, do you need anything else right away? No? Okay. So before I leave the patient's room, I'm going to clean up everything and make sure everything is put in the trash. It needs to be put in the trash or the biohazard container. And then in the bathroom, I have my fracture pan with the old ostomy bag. I would take off the clip, empty that, document on the I&O record the color, the consistency, the amount. I would discard the old ostomy bag into the biohazard, clean the fracture pan, and then put it in the designated area in the patient's room. After I was done with that, I would remove my gloves, throw them away, perform hand hygiene, double check to make sure my patient doesn't need anything. Shirley, did you need anything? No? Okay, well you have your call out right there, so if you need anything, just let me know, okay? Perfect.